The first topic I'm going to talk to you about is pain. You should expect to feel some pain or discomfort after your surgery, but it should not be so severe. Pain is an important role in your recovery. Well-controlled pain can lead to a speedier recovery and fewer post-op complications. If your pain is not controlled, you definitely don't want to hesitate to contact your physician, contact your surgeon, and inform them of the uncontrolled pain. You want to try and pay attention to the timing of when you take your medications. For example, when you go to sleep at night, it's helpful to take pain medication then so that you don't wake up with uncontrolled pain during the night. Immediately after surgery, most patients will wear something called a sequential compression device on their legs, also known as SCD. They squeeze and release and promote circulation, similar to a blood pressure cuff. As your recovery continues and you begin to feel stronger, your nurse will be encouraging you, as well as your surgeon, to spend time out of bed. Sit in the chair, walk in the hallway, and move around in bed as you're able to help promote circulation. You want to contact your surgeon if you have a fever greater than 100.3 degrees or shaking chills, if you develop nausea, vomiting, constipation, or diarrhea, if you notice changes in your wound incision, including redness, warmth, tenderness, and the edges splitting apart, or if your pain is not controlled with the medications that you were prescribed to go home on.
After 6 months on chemo, I enjoyed a period of remission for about 8 months. I had gone to my oncologist to get another scan, and to our great disbelief, the cancer had returned. When she gave me the news, she came into the room crying, and obviously we were devastated. It was the last thing I expected to hear. I was feeling great at the time and really didn't want to face going through another round of treatments. So at news on that recurrence, I was treated to more chemo, more surgery, and then followed up by more chemo. I do want to say that, unfortunately, with this disease, recurrence is a reality, a sad reality. I'll always consider myself a cancer patient. Yes, I'm enjoying a lengthy period of remission right now, but not a day goes by that I don't worry about a recurrence. It's normal. It's part of my normal. But I'm enjoying every day that I'm cancer-free and trying my best to help other people who are stricken with this disease.
Hi, my name is Molly. I'm an outpatient oncology infusion nurse, and a large part of my job is helping patients navigate and manage side effects of their cancer treatments, whether it's surgery, radiation, or chemotherapy. One of the most feared side effects of cancer treatment is nausea and vomiting. The good thing is that we have a lot of great medications these days that can help with nausea and vomiting.
My worst side effect was really being tired. Yes, I had the nausea, not much worse than that, but I really feel lucky that I didn't have as much trouble with it as I had feared.
Patients often experience mouth sores when they're going through cancer treatment. I recommend patients to rinse their mouth after meals and before bedtime with a solution you can actually make at home. It's 8 ounces of water and a teaspoon of salt. Fatigue is probably the most common side effect of cancer treatments. It's helpful to stay well hydrated and to get some exercise. I recommend 2 or 3 times a week trying to get a 20-minute walk-in. Exercise helps your immune system and it helps you just generally feel better. If you do need to take a nap, try to limit it to 30 to 45 minutes. Anything longer will make it difficulty to sleep at night. Another side effect that you may experience is something called neuropathy, and that is numbness or tingling type sensation in your fingers or your toes. It's important to let your doctor know if you are experiencing neuropathy to prevent it from getting worse. In terms of skincare, it's important to moisturize well and also use sunscreen at the same time, because some cancer treatments, like radiation and some chemotherapies, can make your skin extremely susceptible to the sun. When it comes to hair loss, know that not all cancer treatments cause hair loss. Some only cause thinning, and some don't cause any changes in your hair. Many of these side effects from cancer treatments can be scary and overwhelming, but know that a lot of patients only experience 1 or 2 or none at all. But we want you to be aware and know the possible side effects that you can be prepared throughout your journey.
Risk factors involved with colon cancer are really multiple. The first one that is the more fixed and unpreventable are genetics. Patients that have family members who have been diagnosed with colon cancer or colorectal polyps. These are first-degree relatives, put the patient at the highest risk. Other risk factors include physical inactivity. Patients that have a sedentary lifestyle and don't do at least 30 minutes of either on-the-job or off-the-job activity per day are at higher risk for colon cancer. And your risk for colon cancer based on physical inactivity can be reduced by over 25% by just having a more active lifestyle. Losing the weight over the age of 50 actually does reduce your risk of colon cancer significantly and can actually reduce your chances of getting colorectal polyps as well. Another risk factor for the development of colon cancer is the ingestion of processed meats and red meat. We advocate the ingestion of fruits and vegetables, a diet more rich in vegetables, green leafy vegetables, and hence a higher fiber diet, which can reduce your risk of colon cancer as well. The number one risk factor for the development of colon cancer is not being screened, and that way we can actually prevent the development of the colon cancer by the removal of the polyps.